Welcome to this presentation about Meet the Experts titled Meditation, Breathing for Health with our expert Libby Creagh, yoga instructor at Moffitt. Meet the Experts is brought to you by Moffitt Cancer Center's Patient Library and Welcome Center. Please visit moffitt.org/meettheexperts to see our upcoming sessions. The content in this presentation is not intended to be medical advice, and the viewer should consult their physician should they have any medical questions. Viewers should not rely on the information contained in this presentation for immediate or urgent medical needs. If you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of the information you watched in this presentation. And now, please welcome our expert, Libby.
Thank you so much for having me. Today, we will be discussing meditation, breathing is healthy. We'll be going over some simple practices that use your breath and breathing patterns to release stress. When I talk to people about yoga and meditation, one of the first things that I like to share is the fact that breathing is a bridge to the mind. And what I mean by that is when your mind is feeling really active, stressed, or worried, that condition is expressed in your pattern of breathing. Very often when people are feeling a stressful condition, their breathing might become shallow so that you're only using the upper lobes of your lungs. Your breathing might hitch or become uneven. And some people, I'm in this category, might hold their breath when they become really stressed, which you can imagine just exacerbates that sensation of worry and stress and anxiety in your mind. The wonderful thing about this knowledge is that it goes both ways. So just as our breath reflects what's happening to our mind, we can affect the mind by utilizing specific breath practices. Just the act of breathing deeply starts to shift your body physiologically from a stress space into a stress release space. And so we'll practice one of those breaths right here. Let's start by bringing your body into a comfortable space, somewhere where you're able to sit or stand with your spine straight. Invite your eyes to close and place one hand over your heart and one over your abdomen. And in this moment, we are not trying to change anything about your breathing. We're simply coming into an awareness of your pattern of breath right now. An awareness of the sensation of your breath moving in your body beneath the palms of your hands. And just connecting here with that tactile sensation of breath present in your lungs. Noticing each inhale and each exhale. Begin here to direct your inhales towards that lower hand, the hand over your belly. Feeling a way that your belly rounds and presses into your hand as you breathe in. The way that your belly softens away from your hand as you breathe out. We'll spend a few moments in silence just practicing this diaphragmatic breathing. As thoughts arise, know that that's simply what the mind does. Just invite them to fade into the background. Letting the fullness of your breath beneath your hands stay in the forefront of your awareness. Breathing in, feeling your breath growing with each inhale. Breathing out, feeling your body soften with each exhale. As you're ready, release both hands down to your lap. Let your breathing return to an unforced pattern. And simply noticing how you feel physically, energetically, and emotionally here. And as you're ready, begin to open your eyes, returning to this moment. And that was an example of a diaphragmatic breath, a breath that uses up the fullness of space within your lungs. You may or may not notice a shift into that stress release response that our body has. And so here we'll practice a different type of breathing. This is called the 4-part breath. And so often when we think of breathing as having 2 parts, as having an inhale and an exhale. But there's actually a natural space that happens between your inhale and your exhale, and a space that happens between your exhale and your inhale. Now, for this breath practice, we'll be examining those spaces and utilizing them as part of breathing. And so here, if you need to shift your position at all to be more comfortable, please feel free to do that. And as you feel comfortable, invite your eyes to close. Again, bringing your awareness to your natural pattern of breathing. Noticing each inhale and each exhale. Noticing those natural pauses that may or may not happen in between your inhales and your exhales. And here, I'd like you just to begin to count in your mind how long it takes to breathe in. Count in your mind how long it takes to breathe out. We'll spend just a moment here noticing the natural length of your inhales and your exhales. And if both your inhale and your exhale are the same length, then that is perfect. You don't need to change a thing. But if one is shorter than the other, you just lengthen the other so that they're the same length. So for example, if it takes a count of 5 to breathe in, you'll take that same count of 5 to breathe out. And I chose the number 5 as an arbitrary number that's not a goal to meet. Just counting in your mind how long it takes to breathe in, how long it takes to breathe out. And so here we have 2 parts of our 4-part breath. We have an equal length inhale and an equal length exhale. And I'd like you to introduce a count of 1 or 2 for those spaces between your inhale and your exhale. And so here, our inhales and exhales are each the same length. And the spaces between each inhale and exhale are the same length to each other. We'll spend a few moments in silence here, just internally counting the length of each part of your breathing. Good. Take one more breath cycle here. And after your next exhale, keep your gaze inwards, but allow your breath to return to an unforced pattern. Just observing now the speed with which you're breathing, the smoothness of each breath. Notice the presence of any thoughts or emotions here. And as you're ready, you can invite your eyes to open if they've been closed. You might have noticed that the 4-part breath is a little bit more active in your mind, right? So for diaphragmatic breathing, we have our hands on our body, and our mind is focusing on the breath, but not much else, which leaves a little bit of space, or depending on how active your mind is today, a lot of space for your thoughts to barge in. Because we're asking you to count your inhales, exhales, and those little spaces between each breath, your mind is more occupied, which makes it a little easier to stay focused in the present moment. We're going to continue with another type of breathing, and this practice is called our alternate nostril breath. This practice assumes that you're able to breathe easily through both of your nostrils. Now, if you find that today you're feeling stuffy in one or the other of your nostrils, I'd like you just to imagine that you're following along. That very often can have a very similar effect to actually breathing through alternate nostrils. And so we never want to force a breath or stop your natural flow of breathing if you're feeling stuffed up on one side or the other. Good. So if, like me, you're wearing glasses, you'll just take those off, get those out of the way so that you can bring one hand up to your face. I like to support my elbow in my hand. It's just a little more restful for me. You can do that or not. And you don't have to make the same position of your fingers as a gentleman in a photo does here. You can just use one finger. It could be a thumb, a pointer finger, or your pinky. And so we'll start just by holding your elbow, inviting your eyes to close, and just coming into an awareness of your natural breath. We always start here before we introduce any breath practice. So just noticing each inhale, each exhale. Here, you can invite an awareness of the feel of air in your nostrils as you breathe. And perhaps noticing if the air is more present in your right or your left nostril. Or perhaps you can feel it equally in both nostrils. And after your next exhale, let's use one of your fingers to cover your right nostril. And we'll just breathe in and out through your left nostril. The next time you exhale out of your left nostril, and just switch your finger, breathing now in and out of your right nostril. And the next time you exhale, go ahead and release both of your hands down to your lap. Observe your breath here as it returns to an unforced pattern. Noticing here the busyness or the quietness of your mind. Presence of any thoughts or emotions. Noticing here the way your breath is moving in your body. And you're ready. Invite your eyes to open, returning here to this space. And so those were 3 examples of different types of breathing techniques you can use. One is not better than another. They all are helpful. Really just depends on how your body and mind respond to them in the moment. So I'll encourage you when you start to feel a little stressed, a little anxious, to remember and try one of these different types of breathing practices. So I am with the Department of Integrative Medicine here at Moffitt, and we have several services available to patients. We work very closely with a local acupuncturist who specializes in working with Moffitt patients. And our massage therapists are specially trained oncology massage therapists. We also offer yoga. We have limited in-person availability. We also offer private and group yoga classes over Zoom. All of that is offered at no charge to you as a Moffitt patient. We host a weekly meditation class every Wednesday from 12:15 until 1 o'clock. And we have yoga offered every Tuesday and Thursday. Tuesdays from 11 to 12, Thursdays from 2 to 3 p.m. From time to time, we have a Finding Balance with Cancer program. It's offered with integrative medicine and social work. If you'd like more information on how to access any of these services, you can visit moffitt.org/healing and wellness, or email or call either of these contacts here. Thank you so much for your time and your attention today. I'm grateful to share these practices with you.
Thank you for viewing this session. We offer live Meet the Expert sessions through Zoom. To see a full list of upcoming sessions, please visit moffitt.org/meettheexperts or call 813-745-1690.